Hello and welcome to today's webinar titled Brief Intervention for Adolescents Part 2, Brief Negotiated Interview Using Motivational Interviewing and Cognitive Behavioral Therapy Strategies. I'm Tracy McPherson and I will be the moderator for today's event. If you have any questions about this webinar or any of the webinars in this series, you're welcome to contact me at the information on your screen. This webinar is produced in partnership with the Adolescent SBIRT Project, NORC at the University of Chicago, and the Brief Intervention Group, or the BIG Initiative, and is sponsored by the Conrad N. Hilton Foundation. You can learn more about our partnerships and more about the project at sbirt.webs.com, and you're welcome to contact us at sbirtteam@norc.org. Today's webinar is one of a series on using SBIRT to talk to adolescents about substance use. So make sure you check out all of these important topics. In addition to today's webinar on BNI, using motivational interviewing and CBT strategies, the series also includes a webinar on substance use screening tools for adolescents, Brief Intervention for Adolescents Part 1, focusing on BNI and MI strategies, and discussing options and referring adolescents to treatment. If you'd like to learn more about these webinars and all of the other webinars that we offer at no cost, you can go to sbirt.webs.com/webinars. You can also download a flyer that you can share with your colleagues. So I hope you will take advantage of all of the different webinars in this series and share them with those who might be interested. If you're following along with the Learner's Guide to Adolescent SBIRT, the education presented in this session complements Module 3 on brief intervention and Module 5 on motivational interviewing in the context of adolescent SBIRT. You can request a copy of the Learner's Guide by going to sbirt.webs.com/curriculum. In addition to ordering an electronic copy, you can also order hard copies that are available to you by completing a short order form. You can also access a variety of companion materials at the website, including a comprehensive PowerPoint deck that you can use to help train and educate others. For your future reference, you can download the PowerPoint slides from today's session and other resources on our website at sbirt.webs.com. And you can access all of the information particular to this webinar on a dedicated page that you can see on your screen, sbirt.webs.com/brief-intervention-part-2. After this webinar concludes, you'll receive a follow-up email from us, and that's going to contain instructions for watching the on-demand recording, obtaining a free certificate of attendance, and completing a short evaluation survey. Now, we would really greatly appreciate you completing the survey. Our aim is really to bring you the high-quality professional education you've come to expect from us, and this survey really is helpful to assess how we're doing and to better understand your needs. If you wish to ask a question, you can do so by typing into the questions pane in your GoToWebinar control panel on your computer or your mobile device, and someone from our staff will respond to you as soon as possible after the webinar concludes. Now it's my pleasure to introduce our presenters. So our first presenter today is Dr. Ken Winters, and Dr. Winters is a senior scientist at the Oregon Research Institute, an adjunct faculty in the Department of Psychology at the University of Minnesota, which is where he retired from as a professor in the Department of Psychiatry, where he founded and directed the Center for Adolescent Substance Abuse Research for 25 years. And Dr. Winters has received numerous research grants from the National Institutes of Health and various foundations, and has published over 125 peer-reviewed articles over a 30-year period. He recently co-edited the second edition of the Clinical Manual of Adolescent Addictive Disorders, published by the American Psychiatric Association. And he serves on the editorial boards of the Journal of Substance Abuse Treatment, the Journal of Child and Adolescent Substance Abuse, and the Psychology of Addictive Behaviors. And Dr. Winters received his BA from the University of Minnesota and a PhD in clinical psychology from the State University of New York at Stony Brook. So welcome to Dr. Winters. And now I'd like to introduce our second presenter today. Our second presenter is Carolyn Swenson. And Carolyn is trained as a registered nurse, a family nurse practitioner, and a public health professional. She's currently an independent SBIRT consultant and provides QPR suicide prevention training to professionals and community groups, and motivational interviewing training to primary care professionals and community health workers. Over the course of her career, she has worked as a public health nurse on the Navajo Reservation with migrant farm workers in rural Colorado, in refugee healthcare in Africa with immigrant survivors of torture, and coordinating population-based research in rural Colorado, as well as working on quality improvement in primary care. So it's my pleasure to really welcome Dr. Winters and Carolyn Swenson to be our presenters today, and I'm going to pass it over to Carolyn to get us started. Welcome.
Welcome, everyone. We're very happy to be with you today. I'm going to start us off with some review of brief interventions and then go into our new content for this presentation. So let's review why screening, brief intervention, referral to treatment, or SBIRT with youth. So the use of SBIRT for adolescent alcohol and other substance use is growing across a range of medical and behavioral health settings. It's considered an efficient and cost-conscious approach that can be taught to a wide range of service providers, and it's particularly fitting for adolescents because the content can be readily organized around a developmental perspective. Many substance-using teenagers do not need intensive or long-term treatment, and the client-centered, non-confrontational interviewing approach common to SBIRT is likely to be very appealing to youth. So a reminder of what do we mean by brief intervention. Brief intervention is defined as a behavioral strategy that is short in duration and that is aimed at helping a person reduce or stop a problematic behavior. You can learn more about this concept in webinar number 2 in the 4-part series. And that webinar focused on what to do with respect to brief interventions, especially focused on a certain approach to brief interventions called the Brief Negotiated Interview, or BNI. This webinar, number 3, focuses more on how to do it. So now let's go into the new content for this webinar, motivational interviewing and cognitive behavioral strategies that make brief interventions effective. So it's probably no surprise to any of us that change is difficult. It's actually part of the human condition. So change can be difficult for individuals of all ages and perhaps especially so for adolescents. Brief interventions are designed to help adolescents take the first steps toward making healthy changes. And adolescents have to choose to change and to do the work, but a brief intervention is a valuable technique to help them change a behavior. And it's one that's especially useful when addressing substance use behaviors. So the techniques of motivational interviewing, also known as MI, and cognitive behavioral therapy, or CBT, form the core of brief interventions to facilitate the change process. So this actually brings us to our first audience polling question. I'm going to read the question and the response options, and we'll let you respond. So which of the following, or which of these is an example of a confrontational style? You're going to hurt yourself or your parents and your family if you don't stop. You're wrecking your life because of your drug use. If you don't stop now, you will die. Your denial of the problem tells me that you have a problem, or none of the above. So please select all of these options that you think apply as a confrontational style. Give you a few moments to respond. Okay, so it looks like a very large majority of you chose all of the four statements that I read. 83% saying that you're going to hurt your parents or family if you don't stop is confrontational. 81% saying your denial is tells me that you have a problem. 80% agreed that you're wrecking your life because of your drug use is a confrontational style. And 79% of you said, if you don't stop now, you will die. Okay, and only 7% said none of the above. Okay, so let's explore this topic a bit more. So brief interventions really make sense for adolescents, and we're going to talk about why a style using a non-confrontational approach is far more effective than a confrontational style. So brief intervention techniques are used to help adolescents and young adults explore negative and positive effects of alcohol or other substance use. It also helps them explore their motivations to change those negatives and their confidence and competence to change in a direction of a healthier way of living. And it also helps them come up with options and plans that they generate and carry out that are going to work for them. So it's truly a non-confrontational approach. And it's important to remember and understand that the practitioner cannot provide the motivation to change by directing or browbeating or humiliating an adolescent. And in fact, a confrontational style addresses adolescents as if they're out of touch with reality, or they're being dishonest, incapable of responsible self-direction, or that they're deficient in knowledge and insight, and that they're pathologically defended against change. In other words, they simply do not want to change, they refuse to change. Instead, when working with adolescents, we need to take a non-confrontational approach that promotes insight, self-understanding, self-efficacy, and these are all critical skills to develop at this stage of life, and they use CBT strategies. So when working with adolescents, practitioners may fall into a trap of taking a parental role with a directing, judgmental, or moralizing tone. And these assumptions can place the practitioner in a role of correcting errors, combating delusion, taking charge, educating, breaking down defenses, and being the adolescent's link to reality. Instead, brief interventions can promote positive change by strengthening a person's self-confidence and competence and providing guidance to generate self-change options and plans. So it really is about empowering adolescents to own their decisions, and these skills that we're helping them develop and put into practice can be beneficial for many other challenging choices and decisions they may face down the road. So here are some examples of confrontational styles. Some of them are pretty blatant and some of them are more subtle. So, and many of them mean well, but they still are confrontational. So here's a couple of examples. You're going to get kicked off the soccer team if you don't stop going to practice hungover after drinking alcohol, or you'll never get into college if you don't stop drinking. So these approaches are rarely effective. In fact, 4 decades of research have failed to yield a single clinical trial showing the efficacy of confrontational counseling, whereas a number of studies have documented harmful effects of a confrontational style, and particularly that is so for more vulnerable populations. So in addition, these more confrontational styles or statements tend to trigger defensiveness and lead the adolescent to argue against changing. And as we go along today in this presentation, you'll see how important it is to help an adolescent argue for change instead of against change. So, some other important things to note about brief interventions. Not all adolescents want to change their behavior. They may not feel they have a problem with a substance, or that it's not their first priority at this point in their life to address it. And even when the adolescent knows the potential consequences, change is not necessarily made and sustained immediately. So the choice truly is the adolescent's, and we need to respect their autonomy about that. So the practitioner's role is to activate the internal motivation and help them find their own best reasons and their own best methods to change. And for many adolescents, this is likely to be a process and not a sudden realization. And the process may take some time. In fact, it may take more than one brief intervention to get there. So here are some important definitions to keep in mind as we discuss brief interventions. So first of all, motivation. Motivation is the internal and external forces and influences that move an individual to become ready, willing, and able to achieve certain goals and engage in the process of change. Motivational interviewing is a collaborative, goal-oriented method of communication with particular attention to the language of change. MI is intended to strengthen personal motivation for and commitment to a target behavior by behavior change by eliciting and exploring an individual's own arguments for change. And cognitive behavioral therapy, or CBT, is a set of strategies based on the idea that distorted thoughts, not realistic ones, lead to unhealthy, negative emotions and behaviors. So when a practitioner uses an empathetic style, person-centered style focused on strengths, adolescents are far more likely to engage in the conversation and begin to be willing to explore change. And one more note about cognitive behavioral therapy. It takes a very practical approach to problem solving with the goal of changing those distorted patterns of thinking or behaviors that are contributing to a person's difficulties. So it's really skills-based. So in addition, it's important to note that the goal is, when doing a brief intervention, for adolescents to arrive at the reasons for change that are most influential and most important for them, to create realistic plans and next steps, and to monitor those steps that they're going to be taking to correct or reinforce change. So it's not a set of techniques or tricks for getting the adolescents to do what the practitioner wants. Rather, according to Drs. William Miller and Stephen Rolnick, the developers of the modern motivational interviewing counseling approach, it is, quote, a skillful clinical style for eliciting from clients their own good motivations for making behavior changes, unquote. And it's really important to focus on helping adolescents arrive at the reasons for change that are most influential and meaningful to them, and create a realistic plan to correct or reinforce that change. So it's also really important when learning how to do brief interventions using motivational interviewing and CBT to discuss what we mean by ambivalence and the importance of ambivalence in the change process. So first of all, ambivalence is having positive and negative considerations about, equal weight that shift back and forth, that keep an individual from making a decision and moving forward. Ambivalence is something we all experience, and it's important to normalize that this is part of the experience of change, so that people don't feel so ashamed of it or unsettled by it. And the way to do that is to use empathetic responses to the ambivalence that's going to come out into the open during this brief intervention. So even when someone wants a change to happen, when they think it's a good idea, ambivalence is often present and it has to be worked through. And if we don't address it, it will impede progress. So, what do we know about how ready people are to change? So in a representative sample across more than 15 high-risk behaviors, it was found that fewer than 20% of a problem population are prepared for action at any given time. Yet, more than 90% of behavior change programs are designed with this 20% in mind. In other words, we're not addressing the fact that most people aren't necessarily at this moment in time ready to change a particular behavior. So your clinical task is to help the 1 in 5 people who are ready to make changes now, and to work with the 4 out of 5 who are not ready to move in the direction toward greater motivation and action. And we're going to talk about how to do that very specifically. So when do people change? People change behaviors when they first become interested in or concerned about a need for change. They become convinced that the change is in their best interest or will benefit them more than cost them. And they organize a realistic, feasible plan of action and take the actions necessary to make that change and sustain that change. It's also important to note that people need to have confidence when they're making a change. They need to believe in their own ability to change. And that's another important factor in helping people move forward. And motivational interviewing and CBT can help us help people do that, build confidence. So another important part of understanding the change process is to discuss what we call the stages of change. And Prochaska and DiClemente have found common stages of change over hundreds of behavior change studies. And it's really valuable to understand the definitions of these changes, or these stages, in order to understand where is a person at and how do we meet them where they're at when discussing change. And each stage has particular tasks that we can help people accomplish during that change, to move through that change. So let's examine these stages. First of all, pre-contemplation. In pre-contemplation, the adolescent is unaware or underaware that substance use is unhealthy. They don't see a need for change. They may even feel hopeless, and they wish others would change so they don't have to. They most likely have very little interest or no interest in changing the behavior in the foreseeable future. In the contemplation stage, an adolescent is somewhat aware of unhealthy substance use behavior and maybe and how it's affecting their life, and maybe is even considering that change might be a good idea, but they're ambivalent about changing. They may also feel hopeless or lack a lot of confidence to change. They're not maybe even sure what to do to take the next steps. In the preparation stage, an adolescent is making a commitment to act, developing a plan, but has not yet taken those steps or started to change yet. They may test some initial steps. They may feel hesitant and uncertain about their success. In the action stage, an adolescent would be taking the plunge, so to speak. They've started to change behaviors. They've started to change their thoughts about the patterns of unhealthy substance use, and they're beginning to create new behavior patterns. In the maintenance stage, an adolescent is able to sustain changed behaviors and thoughts over an extended period of time. They continue to make positive changes in other areas of their life, and they're developing new coping skills to respond to stressors and the changing environment they may encounter. The maintenance of a changed behavior also works to prevent relapse. So relapse, also known as recurrence, is when an adolescent falls back into old patterns of unhealthy substance use behaviors. And then termination would be the stage where an adolescent has complete confidence or self-efficacy that they can maintain new behaviors, for example, abstinence from substance use, and not return to unhealthy behaviors, and that they're able to cope with the fears of relapse and the stressors that may come along around substance use. So as a practitioner, you have opportunities at whatever stage of change a person is at to help them work through that stage. The diagram you see on the screen can be used as a handout about stages of change. And the very practical skills of motivational interviewing are what you can use to help adolescents progress through the stages more rapidly than they would on their own. So, for example, in the pre-contemplation stage, you can focus on cultivating ambivalence by raising awareness and recognition of potential risks of substance use. And in fact, there's a worksheet that you can access in the Learner's Guide called the Decisional Balance Worksheet that can be used to help adolescents assess reasons for wanting to or not wanting to change. During the contemplation stage, you can focus on helping to tip the balance in the adolescent's ambivalence by generating reasons to change and focusing on that ambivalence to help them work through it and supporting their confidence in their ability to change alcohol or other substance use. When they're preparing to change and determining that and making this commitment to change, you can increase their commitment to the change. And you can also help them develop realistic options, choose among priority options, and next steps to start to make the change happen. During the action phase, you can help the adolescent implement their plan, revise it if needed, and sustain that commitment to change even when they run into difficulties and setbacks. In the maintenance phase, you can turn changes in thinking and behaviors into healthy habits that will be with them long term. You can resolve problems they may encounter and help them reinforce in their own mind reasons they do not want to go back to unhealthy substance use patterns. And that helps prevent relapse. And then when relapse or recurrence does happen, the focus is on helping the adolescent understand the importance of returning to maintenance as quickly as possible and continuing with the change. And in some cases, even going back to some of the earlier stages and reworking through some of those stages with them. And so this is another example of a handout that you could use in teaching the motivational interviewing strategies and CBT strategies for brief interventions. And you can see that in each stage, there are some very concrete ideas for what you could actually do and offer to the adolescent. I'll just highlight a few of these. In the pre-contemplation phase or stage, you can offer factual information, and then it's very helpful to explore the pros and the cons of the substance use. During the contemplation stage, it's very helpful to explore a person's self-efficacy and that confidence about changing and summarize out loud for them any self-motivational statements you hear them making. During the preparation phase, it can be very helpful to offer a menu of options and explore what steps and options are going to make the most sense for their situation. And also focus on lowering barriers to change. Identify those barriers and strategize with the adolescent. How can we address these challenges? In the action stage, you can focus on helping to identify high-risk situations and figure out with the adolescent, how are you going to cope with these situations when they arise, which they surely will. In the maintenance phase, you can help identify and try alternative behaviors, especially focused on ways of enjoying life and coping with life without using alcohol or other substances. And when faced with relapse or recurrence, it can be very helpful to frame that occurrence of relapse as a learning opportunity, not as a failure, and help them develop alternative coping strategies so that down the road, relapse will be less likely to happen again. So motivational interviewing, or MI skills, are very core to effective brief interventions. So when practitioners effectively use MI techniques, many people with substance use problems decrease alcohol, tobacco, and other drug use, and reduce the risks of injuries and other consequences of substance use. Many practitioners feel that they already use MI techniques in their clinical practice, and many do, but research that actually studies clinical sessions shows big gaps between theory and practice, even in highly trained MI practitioners. So in other words, we all have opportunities to improve our use of motivational interviewing. So one of the most important things to understand about motivational interviewing is that the spirit of motivational interviewing is critical to making it work. So it's not just a set of techniques, but the underlying spirit must also be present. And how a person thinks about and understands the intervention process is vitally important in shaping how the process is going to unfold. So MI holds a belief that each person possesses a powerful potential for change and understands that ambivalence is normal. And there are essentially three fundamental aspects that summarize the spirit of motivational interviewing. First is collaboration. This is truly a partnership between the practitioner and the client. Evocation, meaning to evoke and listen for the reasons for change, the internal motivation to change, and then reflect it back when you hear it. And respect for autonomy, truly respecting that it is the adolescent's choice to change and that they need to find their own approaches and ability to change. In fact, conveying that you believe that change is possible, which is part of that spirit of MI, can actually help make change happen, because your belief that change is possible can actually function as a self-fulfilling prophecy. Okay, at this point, I'm going to turn it over to my co-presenter, Ken Winters.
Excellent. Thank you, Carolyn. That was a very helpful overview of the underlying principles of motivational interviewing. Now we're going to devote the remainder of the webinar to discussing the 8 essential skills of motivational interviewing. These skills are important to use right from the beginning of a brief intervention and are relevant to additional and subsequent interactions and discussions you have with the adolescent client. I hope you can appreciate that these skills are widely applicable in any discussion about motivating any client to change their behavior toward a healthier path. But I concur with many experts that these skills are particularly helpful when working with adolescents. Motivational interviewing skills promote a client-centered approach which can meaningfully promote rapport with the teenage client. To start, the importance of using open-ended questions. The way a question is asked can powerfully affect the practitioner's ability to motivate adolescents to change. Admittedly, it may seem that an efficient way to gather factual information is to ask closed-ended questions, such as those that are phrased in a way that elicit a very brief yes or no response. But then the practitioner will have to ask more questions to understand why the adolescent answered the yes or no. This can result in an inefficient conversation with a series of longer questions from the practitioner and short answers from the adolescent. In contrast, open-ended questions are more helpful in developing rapport and creating the opportunity to support and encourage the adolescent's current motivation to change. Open-ended questions are those that are phrased in a way that encourage the person to explore and share her or his feelings, experiences, and perspectives. And so examples include, and these would be very helpful right at the outset, when you're first meeting a teenager, what brings you to the clinic today? How would you describe ways that your substance use has affected your life? Other advantages of asking open-ended questions include the following. You are likely to elicit more information from the client. It allows the adolescent to discuss an issue for as long as he or she deems necessary or is comfortable doing. And you can then use that extra information from the teenager to help identify what seems to be most important to him or her. And it provides you, the practitioner, the opportunity to listen. The table on this slide illustrates how closed-ended questions can be rephrased to be open-ended ones. Open-ended questions typically begin with a word such as what and how, or phrases such as tell me about. In some instances, an open-ended question is not technically a question, but statements that you're making that implicitly seek a response from the adolescent. What do you do if you slip up into a closed-ended question? A common thing that happens. Follow up with, why did you say no? Or why did you say yes? Or can you describe for me more why you answered that way? Hopefully that can move the conversation along if you find yourself occasionally lapsing into a closed-ended one. Okay, next up, the motivational interviewing skill of affirming. So affirming is defined as recognizing the adolescent's strengths, accomplishments, and assets. Affirmations can refer to his or her goals, values, skills, and experiences, and can be expressed in many ways, such as compliments or making statements of appreciation and empathy. Affirming statements can be especially important for adolescents who may lack support in their environment and may suffer from low self-esteem. We provide some examples here. Thank you for showing up for this appointment today and being willing to talk with me. I appreciate your willingness to discuss these things with me. I can tell you that you really care about the other people in your life. I can see that you care about your future. Being a good role model to your younger siblings is important to you. Or this, getting through school is one of the most important things in your life right now. Some more about affirming statements. I'm going to review quickly 8 ways or approaches that you can create affirming statements. Focus on strengths. For example, I've noticed that you are really good at identifying strategies which help you reduce stress. Encourage persistence in the face of past problems. Some might call this grit. You did a great job in dealing with pressure from your friends to vape when you made a commitment to cut back. A related one, making encouraging statements. One way to think about this is, when possible, show a bias towards the sort of glass half full perspective rather than glass half empty perspective. You're making great progress. Tell me how you feel in comparison to 2 weeks ago. Acknowledging the positives. For example, it seems to me that school is going better for you. You're getting to school on time and are no longer getting into trouble for being late. That must feel really good. And 4 more. Point out and celebrate steps taken so far. I'm very proud of your progress. You've come quite far in 3 weeks. Remind the client of past successes. I know this appears very difficult to overcome, but you've been able to do it before. Compliment willingness to talk about difficult issues. Thank you for taking a few minutes to talk with me about your substance use. I appreciate your openness and that you're sharing your experiences with me. And the last, celebrate the adolescent as a person. Give compliments as best as you can. You are willing. You are a kind and warm person. I can see how this problem affects you. A challenge clinically is how you would use affirming statements for a very distressing situation. When possible, instill confidence that you and the teenager are going to discuss strategies that deal with difficult situations. Remind the teenager that change is possible for everyone. Next up, reflective listening. So, reflective listening, also known as parallel talk or paraphrasing, occurs when the practitioner carefully listens to an adolescent's thoughts, perceptions, and feelings, and then restates them for the purpose of clarification and further exploration. Ideally, most of the practitioner's time in a session should be spent listening. Listening is a very powerful and underutilized agent of change. By doing so, it demonstrates that you have empathy and a genuine willingness to try to understand the person's perspective. Benefits of being a good listener include careful listening tends to support a client's ability to explore and problem solve their problems. It can prompt the person to begin to talk themselves into change. Then consider the psychology that underlies being a good listener. People are generally more impressed by and tend to believe in what they hear themselves saying compared to what practitioners or someone else tells them. This example illustrates how an adolescent may say one thing and mean something entirely different. I will role play the adolescent, and Carolyn, you're going to help me out and role play the part of the practitioner.
Yep.
Okay. I will start. I hate my coach. I should just quit the soccer team.
So you hate your coach and think it would be better for you to quit playing soccer.
Yeah. My coach is always hassling me to work harder and faster, but it's hard to commit all those hours after school when I have so much homework to do. I'm under a lot of pressure. So, one time I went over to my buddy's house after practice, and his brother gets us some beer. We just hang out and play video games. Well, then the next day, though, I'm so tired at school, my head is pounding, and I'm even feeling a bit sick. But still, I know I have to keep up with practice and everything my coach is asking of me.
So what I hear you saying is that because your body is hungover from the previous night's drinking, you're finding it difficult to perform at your best in soccer practice.
Yeah, okay. Yeah, I guess that's it. Yeah, I guess so. Okay. So, and thank you, Carolyn. Taken at face value, you might make a case the adolescent hates soccer because the coach puts so much pressure on him to work hard. But we learn by the practitioner being a good listener that the adolescent is perhaps not performing at his best at practice due to the physical effects related to drinking. Hopefully you noticed several reflective listening statements by the practitioner to help the adolescent feel he was being heard, and doing so kept the discussion focused. A bit more about reflective listening. This kind of skill can help the practitioner avoid roadblocks that prevent clinical progress. Roadblocks are negative. They tend to break up or change the direction of the adolescent's thought processes and make it difficult for the adolescent to explore feelings and thoughts and solutions. You can see here 6 examples of roadblocks. Commanding, that's imposing a view on the adolescent that he or she needs to act in a certain way. Threatening, warning or cautioning the adolescent about what might happen if there is no change. Prematurely giving advice, offering unsolicited solutions or making suggestions. Moralizing, telling the adolescent what to do. Criticizing, disagreeing with the adolescent, which implies judgment or blaming. And the last, shaming, labeling or ridiculing the adolescent in an effort to make him or her feel better, but it makes the teenager feel humiliated. Okay, here are several examples of reflective listening phrases. Each has the following characteristic. It clarifies and reflects back the practitioner's understanding of what the adolescent is trying to convey. A sampling. I understand the problem is. As I hear it, you. In your experience. Let me see if I understand. You are, from where you stand, and the final one, could it be that, and this last one provides an opportunity to move the discussion in a different direction. So when you see perhaps that things are not moving very well in a session, perhaps the client is spinning her or his wheels, so-called, you could try to move the conversation in a more fruitful way with a statement like that. Hopefully you notice that with these examples, the practitioner is not simply restating the adolescent's thoughts verbatim. The goal of reflective listening is to slightly adjust the adolescent's words to encourage more thought and discussion. Another example, the adolescent might say, I don't have a drug problem. I just smoke a little weed every night before bed to help with sleep. Practitioner, you use marijuana every day of the week, and you do not feel that this is causing a drug problem. Reflective listening may also include the practitioner's inferences based on previous statements of the adolescent. This is called continuing the paragraph. However, with this technique, be careful not to overreach and go too far beyond what the adolescent is trying to convey. An example of an overreach is the following. The adolescent might say, I don't want to grow up to be like my parents. They never cared for me like they should because they're always drunk or high or gone. Practitioner, you want a better life for yourself than your parents' lives. So you are here to ensure that substances do not interfere with that. Perhaps a preferred way of saying it would have been, you do not want to repeat what is going on with your parents. I can see your point. First way was a bit overreach, second way, preferred. Time to summarize some key points about reflective listening. Most of the practitioner's responses in a session should be reflective listening statements. Doing so helps the adolescent make their own solutions using their own resources and motivation. There may be a tendency to think that a heavy dose of reflective statements is not effective in moving the adolescent to the action stage, but this is not the case. It actually can be counterproductive to engage in numerous asking questions and getting answers and asking more questions and not really moving the motivation ball forward. Also, reflective listening statements work well with open-ended questions. Here's a reminder from a previous webinar. A general rule of thumb. The practitioner should try not to ask more than 2 open-ended questions in a row and make at least 2 reflective listening statements after each open-ended question. Not more than 2 open-ended questions, and try to make 2 or more reflective listening statements. You can see the more reflective listening, the better. The 4th motivational interviewing skill is summarizing. Summarizing promotes behavior change in several ways. It allows the practitioner to help the adolescent see patterns. It highlights similarities or inconsistencies. And it emphasizes the adolescent's choices and strengths. There are several tips in using summary statements effectively. Number 1, use it sparingly so as not to interrupt the flow of conversation. Second, consider concluding the summary with an open-ended question, such as, what else? Now, not a good summary type statement would be, did I miss anything? You might see the problem with that statement. It's too close-ended. Easy for someone to say no, and you're not maybe getting what you could get with a more open-ended approach. Some more tips about summarizing. Linking summary phrases such as on one hand and on the other hand can help the adolescent acknowledge conflicting statements without aggressively confronting the inconsistencies. When an inconsistency arises, more discussion can occur. The practitioner can also use summarizing to correct faulty conclusions made by the adolescent or redirect their arguments for not changing. And then a final tip. When possible, provide a summary in conjunction with open-ended questions and reflective listening. So let's give this a try. We've talked about summarizing. It is important because it brings together thoughts and feelings presented by the adolescent at different points during the current interaction or in previous interaction. It also encourages the adolescent to reflect on thoughts or feelings that she or he may have not seen as related or interconnected. In the trio of using open-ended questions, reflective listening, and the summary statement is an effective use of motivational interviewing skills. So here is an example. I will role play the adolescent and will bring back Carolyn, who will help out, and she will role play the practitioner. I don't understand why everyone seems to think I have a drinking problem. I only drink on weekends after tough weeks of exams and writing papers. Everyone does that. And heck, I enjoy being out, watching a game, drinking, being with friends. I'm usually the last person at the party. It gives me a chance to hang out with lots of other people.
So, because you only drink on weekends, when you feel stressed from a tough week at school, you feel you don't really have a drinking problem any more than any of your friends.
Yeah, right. So I have a few beers to relax. What's the big deal? I mean, I see the same group of people at my friend's house every weekend partying and drinking just like I am. And you don't see any of them sitting here right now, do you?
Okay, I see where you're coming from. So tell me more about how much you drink in comparison to your friends.
Well, I throw back a few beers just like everyone. Actually, I think I can handle drinking way better than they can. My friends are kind of lightweights. They're too drunk after the first few, and sometimes they have to go home quick, and they're making fools of themselves. I can drink twice as much as they can. I've got an iron stomach, I guess.
So you seem to have a different perspectives on your drinking. On the one hand, you see yourself as just like your friends who are partying with you, and on the other hand, you see yourself as frequently drinking more than your friends and mention that they leave before you do.
Thank you, Carolyn. Hopefully you saw from this how the practitioner moved the adolescent who seemed to be not too interested in thinking he or she might have a problem, but had him discuss how his drinking compares to others. And it brought to light that perhaps he is a heavy drinker, and this information could be used later because there's a risk factor there, and perhaps that's a opportunity for change or an opportunity for setting some goals in terms of reducing the use of alcohol, which may be at a binge level for this person. So now Carolyn will discuss the important skill of eliciting change talk. Handing it over to you, Carolyn.
Thank you, Ken. So yes, the next key motivational interviewing skill for brief interventions is eliciting change talk. So a reminder, again, you can't make an adolescent change, but you can stimulate the adolescent's internal motivations to modify behavior or initiate new behaviors. And you can, as the practitioner, see yourself as a guide or a coach to help adolescents figure out why they want to change, and then create a plan based on their personal reasons and motivations. As noted earlier, the primary purpose of motivational counseling is to uncover and stimulate their own internal motivations to modify behaviors. Remember, you don't have the power to make an adolescent change, and most of the time, you actually don't control the incentives or the punishments that could generate the external motivators to change. So, but you definitely can help an adolescent verbalize reasons for and advantages of changing behaviors, and that's what we call change talk. Discussing the actual change may not occur now, but it could occur down the road in the future. And so even talking about change before they're ready to change is valuable. So when we say change talk, what we mean are the statements that an adolescent may say that favor changing unhealthy behaviors and describe the reasons for and the advantages of changing. So there's a number of ways to elicit change talk, and we're going to explore several of these ways that you can do this. So you have many options for eliciting change talk. And by eliciting this change talk, you, again, are helping them talk out loud about their own arguments and reasons for change. And as we just heard a bit earlier, when the adolescent hears their own voice talking, that can be really powerful. And when you hear change talk happening, you know that they're moving forward in the process of change. Sometimes they hear themselves talk about change, and then you actually hear them begin to figure out how the change would benefit them, but also how they would carry out the change. And remember that the more change talk you hear, the more likely the change is going to happen. When you do hear that change talk, you want to recognize it, acknowledge it, and reflect it back, and encourage them to talk about it even more. So let's now explore what we call asking evocative questions to prompt change talk. So evocative questions are simply questions that elicit change statements from the client or the adolescent. And there are 5 categories of evocative questions that we refer to in motivational interviewing, and we sometimes give them the acronym DARN-C. So let's look at each of these. The first is desire to change, and you might evoke that or elicit that by asking something like, why might you want to make a change? Second is ability to change. How have you changed in the past and been successful? Reasons for change. What are your concerns, or what are some of the reasons you can see that change might be a good idea? Need to change. What makes you think that you need to do something differently or make some sort of change? And commitment to change. So what do you think you'll do? What's the next step? So again, these are known as darn C and a very core part of motivational interviewing. So here's some additional examples that you could use to evoke a person's desire to change. You could say, why might you want to make a change in how much marijuana you smoke? If you used or stopped using marijuana, what could be better in your life? Or what do you wish were different about your life or your situation right now? And how does marijuana fit into the picture? All of those questions may elicit a person to talk about their desire for something to change and be different. Here are some examples of evocative questions that you could use to elicit a person to talk about their ability to change. You might say, how might you go about making this change if you decide change is a good idea? Or what's the first step you would take to make a change in your use of alcohol? Or what encourages you that you can change if you decide it's a good idea or you want to change? Or what personal strengths do you have that could help you succeed in making a change? All of those questions and the others on the screen are likely to evoke someone to talk about their ability to make a change. And this feeds into helping them build their self-efficacy and confidence that change is possible. So another type of change talk that you want to encourage adolescents to talk about are their reasons to change. So here's some statements or questions you could use to evoke reasons. What are some disadvantages of your current drinking pattern and if things stay the same? What are some of the best reasons you can think of to stop using opioids? Or how has your use of oxycodone affected your school performance or other important things in your life? All of these and the other statements you see are likely to help someone talk out loud about reasons that change might be a good idea. And then let's look at questions you can use to evoke statements about a need to change. Here's some examples. How will your life be better if you make these changes? Or how is vaping nicotine getting in the way of what matters most to you in your life right now? Or in what ways do you think you or other people have been harmed by your smoking of cigarettes? Or if you stayed the same with your current smoking or drinking pattern, what negatives might happen? And what positives might happen if you change? All examples of ways to evoke a person talking out loud about the need to make a change. And next, some examples of statements you could use, questions you could use to evoke a person's commitment to change. So what's the next step you will take to change your Ritalin use? Or what approaches or steps could you use to keep yourself on track with making this change in your drinking? Or who will you ask to support and help you as you are making this change? All things that can help strengthen a person's commitment to move forward with change. So next, let's explore another way to evoke or elicit change talk when you're using motivational interviewing to discuss and provide brief interventions around substance use. The next technique we're going to explore is called using readiness rulers. So, very important and useful technique. A readiness ruler is a tool that can assist adolescents in determining how central or how important changing is to them right now, and how able or confident they feel about making the change. Using the ruler can give you and the adolescents graphic feedback about their progress And it can stimulate reflections about the adolescent's motivation to change and elicit even more change talk. And so there are really 3 types of readiness rulers that we encourage you to use in these brief interventions using motivational interviewing. To assess a person's readiness to change, to assess the importance of the change to them, and to assess their confidence about changing. And most patients or clients easily grasp how the readiness ruler works. So really it's very useful in almost all cases. Some rulers use a 0 as the starting point for not at all ready, and others use 1. And really both are valid. They both function in the same way. So let's look at asking about readiness to change. This is often where you begin when you're using a readiness ruler. So you might say something like this. What you want to hear or what you're looking for is how ready they really tell you they are on cutting back or changing substance use. And when they're ready, even to make small steps, you know that it's moving in the right direction and can reduce their risk. So here's what you might ask. On a scale from 0 to 10, where 0 is not at all ready and 10 is very ready, how ready are you to reduce or completely stop drinking alcohol at this point? And you let them respond. And again, take note of that number because you're going to use that number in how you respond to their readiness. So let's look next at how you might ask about importance. So importance is basically getting at what's the current value of the change to this individual at this point in their life. And you might hear them say something like, I want to stop drinking because it's getting harder to get up and go to school on time. And that could lead to me losing my chance of getting into college. So you're hearing some desire and reasons to change, that because this change is becoming increasingly important to them. So here's how you might ask about importance. On a scale of 0 to 10, how important would you say it is for you to not be hungover and to be ready to perform your best during your game on Saturday, with 0 being not at all important and 10 being extremely important? And then you let them respond, and again, take note of the number because we're going to talk about how you use that number to explore importance with the adolescent. So when assessing confidence, what you really are getting at is their ability, their belief in their own ability to change. So you might hear an adolescent saying something like, I'd like to quit, but I'm not sure I can. Vaping with my friends is kind of fun. And when I've tried to stop before, they just hassle me and I find it really hard to resist. I'm not even sure I could stop if I wanted to. So they have desire in that statement, there's desire to change, but they're really quite unsure of their ability. And confidence, remember, is very often a barrier because many adolescents may have already even tried to make a change in substance use and found that they've been unable to do it and they don't feel good about themselves. So normalizing how hard it is to change can really help them feel more confident and help them strategize ways to address barriers. So here's how you could use the confidence ruler. On a scale of 0 to 10, how confident would you say you are about being able to stop using cocaine, with 0 being not at all confident and 10 being extremely confident? And again, remember the number they choose. So let's talk about how you use that number that they have chosen and explore their ratings with them. So when you hear them say any number at all, we encourage you to first of all say, what led you to pick that number, like a 6, and not a lower number like a 2? Or what led you to choose a 2 and not a 0? This allows the person to talk more about change. And if you were to do the opposite, conversely, to say right off the bat, what led you to choose a 6 and not a higher number, you might start to hear the adolescent talking against change. Now, eventually, it does make sense. After they talk about reasons for choosing that number and not a lower number, it does make sense to ask, what would it take for you to go from a 6 to a higher number like a 7, or from a 2 to a higher number like a 4? So let's say an adolescent chooses 0. What would you do? So first of all, acknowledge it. It may not happen often, but it could happen. So you acknowledge it, just say, so it sounds like right now this change is not important to you at all. Then you affirm autonomy. You could say something like, it is totally your decision what to do, whether to change your substance use or not. I only want what's best for you. And then you can follow up with a friendly, inquisitive question. For example, what would tell you that smoking weed was becoming a problem for you and that change was a good idea? Or how would you know if the time was right for making a change to achieve the goals that you have set for yourself at this point in your life? So let's explore next another approach to eliciting change talk known as exploring the status quo. So this can help explore change talk or elicit change talk when they talk about the advantages and disadvantages of continuing to use substances at the current level rather than changing their substance use patterns. Exploring the status quo can help adolescents verbalize the two sides of ambivalence that are often keeping them stuck in unhealthy behaviors. This can really help clarify their thinking, and again, it allows them to talk out loud about what's going on and what the effects of substances are currently on their life. Many adolescents may have never verbalized out loud the benefits from not changing, and this helps them really talk out loud about both sides of the situation, the ambivalence. And you can also, by exploring the status quo, help an adolescent generate their own values and beliefs. And this can, again, support positive change because most people want to be true to their own values and beliefs. So remember that in almost all cases, there are advantages and disadvantages to the adolescent's current behavior. So by letting them talk out loud about their values and beliefs, you can support positive change. So another approach to eliciting change talk is what we call ask for elaboration. So let's look at asking for elaboration. So when an adolescent makes a change statement, you as the practitioner can reinforce that change talk by asking them to explore it in even more in greater detail. If they, for example, express that they use some substances too much, you could jump on that opportunity and ask them to say more about how much are they using, how often, what do they consider to be too much, and what are some of the effects of using substances too much. You might ask them to also describe a specific example, such as what happened when you had too much to drink, what happened that night, and how did you feel the next day? What were the downsides of that? And this is all, of course, allowing them to talk even more about change. So consider the importance, whenever you hear any change talk, to ask them to elaborate even more on what you're hearing. And this helps them even more fully explore their motivations to change, and you're going to likely hear even more reasons that they would favor change, which can start to tip that decisional balance toward positive action. So here's some examples. Tell me more about how much you're using. What do you consider too much? Describe an example of when you think you used marijuana too much. What happened next? How did you feel? All examples of elaboration. Another way to elicit change talk is to ask about extremes. And what we mean by this is to ask the adolescents to describe the most extreme negative or positive consequences that might occur and their likelihood. So when an adolescent makes a change statement, you can reinforce that by asking them things like, what are the worst things you could imagine happening to you if you did not stop using heroin? Or what worries you the most about continuing to drink alcohol? Or what are the best things that could happen if you stopped drinking alcohol? What are some of the great things you hope will happen by not smoking marijuana? You might also find it useful to ask the adolescent to consider how likely they consider the extreme negatives or extreme positives to be. So, for example, if the substance use pertains to drinking, you could say something like, how likely do you feel it would be that if you keep drinking at this level or keep drinking at all, that you're likely to get a DUI, maybe even lose your license, get kicked off the team, and jeopardize some of your goals for yourself, like getting into college, or even injure someone else. So you can, that's an example of exploring the extremes. Another example would be, how likely are you that if you stopped smoking marijuana, you would actually start to get your homework done, be more likely to pass your biology class, and get to where you want to be after high school? So that's, again, exploring extremes, like extreme good things that could happen if you change. Another way to elicit change talk is to do what we call looking backwards and looking forwards. So this is simply talking about exploring with the adolescent times before they were drinking or using other substance use, and when you're looking backwards, and comparing now to that time before the substance use became part of their life. So asking them to describe or compare a time before they were drinking can highlight how much alcohol or another substance has started to negatively affect their life. Here's one example. Tell me about a time when your relationship with your parents was going well. And they might talk about a time before alcohol got in the way of the relationship with their parents. Another example might be, suppose you were someone else describing you before you started using opioids. Tell me what they would say about you. So again, this can highlight how substances have started to negatively affect their life. By asking the adolescent to look into their future or looking forward, you can elicit in their own words the likely outcome if they do not change drinking or other substance use patterns. For example, you could say something like, where do you think you will be 1 year from now if you continue to drink alcohol at this level? Or where do you think you'll be 2 years from now if you continue your daily use of Xanax? And this again can help them think ahead to how the substances could harm them and get in the way of their goals, and talk out loud about why change might be a good idea. And one more approach to eliciting change talk would be exploring goals and values. So when we say exploring goals and values, you literally simply want to ask them what are some of the most important goals and values they hold that are in their life right now. This can help highlight the gap between what they really want and what they have right now. You are helping to sharpen the positives and the negatives of their substance use by having them talk out loud about their goals and values. Perhaps the adolescent, for example, wishes to improve their school performance or be a better teammate, improve relationships they may have with parents, guardians, friends. Maybe graduating from high school is a goal or a value, or looking into their future after high school, like getting into the military. So if the adolescent places a high value on having friends and all their friends drink or use substances, then your efforts are focused on eliciting change talk involving non-drinking or non-substance using friends. So one of the most basic things you can always ask in all cases is, so what matters most to you in your life right now? You can also ask something like, what kind of a person do you hope to become as you grow into adulthood? And these questions can lead into using cognitive behavioral therapy strategies to really help strategize positive next steps that they can take to reach their goals. And often this will highlight that changing substance use is necessary in order to reach that goal and be true to the values that they hold in their life. So this brings us to our next polling question. Again, I'm going to read the question and your response option. So which of the strategies for eliciting change talk that we have just gone over can you implement in your work starting as soon as tomorrow? Ask evocative questions, use readiness rulers, explore the status quo, ask about extremes, explore goals and values. And please choose all that apply, and we'll give you a few moments to respond. Okay, so it looks like 89% of you, a very high number, reported that you could imagine exploring goals and values with adolescents starting tomorrow in your conversations about substance use. Next up was asking evocative questions to elicit that change talk, that desire, ability, reasons, need, and commitment. Using readiness rulers also got a pretty high mark, asking how ready, how confident, how important is this change to you on a 0 to 10 or 1 to 10 scale. Exploring the status quo and reasons for and reasons against change is another pretty high number, and asking about the extremes, extreme positives and negatives that may happen down the road if substance use doesn't change. So it looks like you are feeling quite ready to put some of these techniques into practice.
So next up is motivational skill number 6, asking permission and giving advice. It is desirable that an adolescent should be the source of ideas for changing unhealthy and problematic behaviors. As we've noted earlier, when an adolescent has ownership of solutions to problems, behavior change is enhanced. But you as the practitioner may have advice or insights that can move the behavior change forward. It is best to ask permission first before offering direct advice and be clear that the adolescent is in charge and is welcome to take the advice or leave it. You can take an active role in several ways. Provide assistance, offer support, provide alternative perspectives, and act as a sounding board to a perspective or idea offered by the adolescent. Within a motivational interviewing perspective, there are 3 ways the door can be opened for you to offer advice. First, the adolescent specifically asks for your expertise. Adolescents may ask you for your opinion or recommendation. Second, the adolescent has granted you permission to give advice. But a caution, we can be, as practitioners, very eager to offer our opinions even when the adolescent has not asked for it. Consider going slow along these lines. Third way is when the adolescent is obviously headed in a direction that could be harmful. This is a most challenging situation to the counselor. How can you get your adolescent back on track? But even within motivational interviewing, it's entirely appropriate for you to weigh in and offer your point of view. And to respect the adolescent's autonomy, you follow up your advice with something like this. What do you think of that idea? What do you think of my suggestion? Asking permission reinforces that the strength and responsibility for change is the adolescent's, not the practitioner's. Permission can be requested directly or indirectly. Here are some examples. I have a couple thoughts about your plan of action. Would you mind if I shared them with you? I don't know if this will work or not, but I could give you some ideas of what other people have done in your situation. As a healthcare professional, I would like to offer some advice. Would that be okay? Another. I'd like to share a few ideas on how you might deal with that situation in the future. Would you be interested in hearing them? Now, you might have noticed asking permission can usually include a closed-ended question where you're seeking a yes. But it's not just a fully closed-ended type discussion. You're entering some thoughts to the teenager about how you would like to weigh in, and you're seeking their permission. But an adolescent may not be keen to have the practitioner provide advice. This would be natural. As we have emphasized throughout the use of motivational interviewing, the adolescent owns the change process. If the adolescent is not receptive to advice, that is likely a sign that she or he is not ready for change. This is a time for the practitioner to use the skill of rolling with resistance when faced with this kind of situation. And you have just learned some strategies in the prior Change Talk section. For example, let's take one of those strategies. Have the adolescent envision the future. Or have the adolescent take the perspective of another person close to him or her. Next up, motivational skill number 7, generating a menu of options. The adolescent, of course, holds the responsibility of making changes or not making changes. But you as the practitioner can help to generate options that are likely to help the adolescent with setting goals. How can this be done within the motivational interviewing framework? It's best to start with open-ended questions to initiate dialogue. Examples include, what changes are you thinking about making? What do you think you will do? What can you do tomorrow? Or even later today? What do you see as your options? The adolescent may find it helpful to use SMART goal setting guidelines. SMART stands for specific, meaningful, attainable, realistic, and time-bound. I think this approach is very adolescent-friendly. It can be difficult enough to get an adolescent to think about making meaningful changes. By steering the discussion of goals to meet the features of the SMART model, the client's success in making progress with some goals is optimized. Contained in the learner's guide are the setting goals for change exercise and change plan worksheet. These can be used to help the practitioner and the adolescent develop SMART goals. Some final notes about helping the adolescent generate a menu of options. Try to organize options around the adolescent's strengths and assets. What is the adolescent good at? What supports are in his or her environment? What options can be related to what he or she is comfortable doing and also promote health? Another point. Work with the adolescent to develop several options and explore the pros and cons of each. The adolescent can choose which methods might work best. By offering several options, the adolescent can evaluate choices that are not appealing and ones that could work. So, for example, if the adolescent has previously tried peer support groups such as AA or Smart Recovery and found they helped with heavy drinking just for a while, but the feelings of craving got them back and the teenager succumbed to them and started using again, the practitioner might explore other options, such as perhaps periodic in-person or telephone counseling checkups, or discussing with the adolescent returning to peer support meeting, but taking perhaps a different perspective on it. The final motivational interviewing skill, number 8, managing pushback. Some important context as we consider this skill. As noted, changing behavior is never easy, perhaps even more so for adolescents. So often we are helping a client to change a behavior that is deeply rooted in a person's life and was a coping strategy for the person. It would be normal for most adolescents to exhibit some pushback about changing a problem behavior. So what do we mean by pushback? It's a response from a client that expresses opposition to an idea, observation, or plan. How can you manage pushback? You're probably going to be faced with it to some degree. Miller and Rolnick cite the importance of first recognizing it. They define several types of so-called resistant behaviors. These 5 types are on this slide. Arguing, where the adolescent contests your accuracy, expertise, or integrity. Interrupting, the adolescent breaks in and interrupts the practitioner in a defensive manner. Negating, the adolescent expresses an unwillingness to recognize problems, cooperate, accept responsibility, or take advice. Ignoring, the adolescent shows evidence of ignoring or not following the practitioner. And the final one, perhaps a more subtle form of pushback, false acquiescence. This is when the adolescent falsely agrees to accept responsibility or take advice just in an effort to impress you, or perhaps just to move the conversation along. Once the practitioner recognizes pushback, there are several ways to respond. The idea is to dig through the noise of pushback and tune into what the adolescent is trying to convey. we offer several appropriate responses to pushback. One is called simple reflection. Acknowledge the adolescent's disagreement without causing defensiveness. Example of what a practitioner could say along these lines is, I hear what you are saying and can understand why you would feel that way. Second type is amplified reflection. Here the practitioner reflects back what the adolescent has said in an exaggerated way. Be careful not to be sarcastic and use a tone of voice that actually could create more pushback. But an adolescent might say, my parents and friends think I have a problem with prescription pills. I am doing just fine. With a careful tone, a practitioner could say, okay, you seem to believe that you have complete control over your substance use. Third type, double-sided reflection. Here's where you acknowledge both sides of the adolescent's ambivalence. Now, this requires likely pulling together information the adolescent has offered throughout the session. An example we offer. The adolescent might say, I don't smoke marijuana any more than my girlfriends. Practitioner, I can see your point. You view your use as normal when compared to your friends. But earlier you mentioned that your smoking may be negatively impacting your relationship with your parents and younger sister. What do you think about this? Next up, shifting focus. This involves steering the adolescent's attention away from the source of the pushback. Adolescent might say, I wouldn't be here if I hadn't blown positive on that breathalyzer. Practitioner could come back with, well, I just met you. Why don't we first begin by talking about what was happening that led up to that positive alcohol test? The fifth strategy, reframing. This is acknowledging the validity of the adolescent's perspective and observations and offering a new meaning or interpretation. For example, adolescent says, I've always been able to handle my liquor. I could drink a 12-pack of beer in one night, and most people would not know that I was drunk. No matter how much I drink, I can still handle my business. Practitioner. This is an interesting perspective, and I can see how you would view that as a benefit. Being able to drink that much without others noticing, well, yeah, that's interesting. It does indicate a high level of tolerance. You know, this may mean you have a very high risk for developing a serious alcohol problem. We should talk more about that. The next one is emphasizing personal control. Communicate to the adolescent that it is their decision whether or not to make a change. This frees you, the practitioner, of control and puts the adolescent in charge. For example, practitioner says, it is not my place to tell you what you can or cannot do. I'm simply here to help you understand your options and to assist with any elements of this process that you may find troubling. How you live your life is ultimately up to you. The final approach in dealing with pushback, siding with the negative. This can be a form of reverse psychology. It can work sometimes to agree with the adolescent that he or she may not need change. Sometimes when the practitioner takes the negative side, the adolescent will respond by presenting positive reasons to change. For example, adolescent says, I don't know if quitting all drugs will really make that much difference in my life. Practitioner, well, perhaps it won't. You could keep using, or you could try stopping for a while and then see whether the problems in school and with your friends improve. Then you can decide whether or not to stay drug-free or not. So I have just highlighted 7 ways to respond to adolescent pushback. But one more topic here. It's important to emphasize there are ways to not respond to pushback. On this slide, we offer 4 types of responses to an adolescent's pushback that you should avoid. They are arguing for change. Arguing is never good. Assuming the expert role, labeling, and the last, asserting that your goals are more important than the adolescent. You can see 2 of those tend to reflect the fact that it can be easy for a practitioner to want to weigh in, feeling you have expertise and you want to perhaps push one's own advice into the situation. But that can be a bad way to deal with pushback. Okay, time for a role play. Carolyn will now join us, and she will role play the practitioner, and I will play the adolescent. I'm handing off to Carolyn to introduce this.
Thank you, Ken. So this is going to be a brief motivational encounter with a non-resistant or contemplative young adult who's 20 years old. He attends community college, works part-time, and has a girlfriend who expressed concern about their drinking. Okay, thank you very much for answering those questions for me. I appreciate your openness. Would it be all right if I provided some feedback?
Sure, I guess so.
Okay. Okay, thanks very much. Based on your answers to the questions I asked about your alcohol use, it appears that you are at moderate risk of experiencing health, social, and other problems due to the amount of alcohol you drink. What are your thoughts about this?
Well, what do you mean? What do you mean? I mean, I don't really think I have a problem with my drinking. Actually, I don't really know why I scored so high on that scale or that test.
Okay, well, let's explore that. You mentioned before that you enjoy drinking on the weekends to relax and that you generally have about 5 or 6 drinks. According to what we call the lower risk drink guidelines, the recommendation is that young adults should totally avoid alcohol when they're underage, since any drinking puts you at risk for health and other problems associated with alcohol. Young adults such as yourself are particularly at risk for experiencing problems from drinking. You mentioned earlier that drinking has interfered with your school performance on a couple of occasions, that you missed work due to a hangover, and that your girlfriend has expressed concern about your drinking. So what do you think about this information?
Well, okay, I really didn't think about it like that. The way you put it is a little different way. Yeah, okay. In some ways, I guess I'm having a few problems because of drinking.
Okay. So given this information, I'm curious to know how ready you feel you are to cut back or quit drinking altogether. So on a scale of 0 to 10, with 0 being not ready at all and 10 being extremely ready, how ready would you say you are at this point?
Let's see. It's hard to say. I mean, I don't want to mess up my relationship with my girlfriend. She gets pretty mad at me when I get so drunk. In fact, sometimes she won't talk to me for a whole day or so. I have a job and I can't afford to lose that just because of my drinking. But if cutting back meant I wouldn't have these problems, let's see, on a 0 to 10, okay, I'm going to say right now about a 7. And yeah, I'll give myself a 7.
Okay, well, a 7's pretty high. It sounds like cutting back is pretty important to you and that you're quite ready. What do you think makes you a 7 and not a lower number like a 4 or a 5?
Well, I mean, you know, as we've been talking, I guess it's because I do need some of these things to change or some of these things not to happen.
Well, like what things?
Well, you know, like my job in jeopardy, that's not good. Upsetting my girlfriend is bad. overall, I do worry a little bit about my health. I mean, I work out, try to take care of myself.
Okay, so those all sound like very important reasons to make a change in how much you drink. So now, using that same 0 to 10 scale, what would it take to move you from a 7, where you feel quite ready, to a 10, where you would be extremely ready to change?
Oh, you mean to a 10? Oh, well, I know a lot of things would have to change about my friends. I mean, my friends would need to drink a lot less, because, that's a big challenge.
Okay, so it sounds like your friends are really important to you. How would it be if you explained to your friends that you are cutting back on your drinking for health reasons and because you care about important things like school, your job, and your relationship?
I wonder how they'd think about that. Maybe they'd understand if I explained it well. I'd have to have a good way of explaining it.
So it seems like your friends would support you and your goals if they understood where you're coming from.
Yeah, I have good friends. I think they would.
So what would this change actually look like in terms of how much you will drink when you're out with your friends?
How much? So limits, huh? Wow, I'm not sure. What are you saying about limits?
Well, first of all, I do need to emphasize that no alcohol until you're 21 is the very best choice. And then for men 21 and older, up to a total of 14 drinks in a week and never more than 4 in one day is what we consider the lower risk limit.
4 in one day. I guess it wouldn't be such a big deal to try to stay within that daily plan of no more than 4 drinks. Yeah, that's interesting.
Well, that sounds like a good idea. And how comfortable would you be with staying in the 14 drinks per week limit? No more than 14.
Well, I mean, maybe I should set the bar a little higher. That's pretty easy for me. I mean, I usually hit that limit on a weekend.
You only drink on weekends. Okay, so that sounds like a good plan, to never have more than 4 drinks when you go out with your friends and never exceed the 14 in 1 week. So how confident do you feel about sticking to this plan, say again on that 0 to 10 scale, where 0 is not at all confident and 10 is very confident?
Okay, let's see. I gave a 7. All right, let's move it up to an 8. I'm a little more confident as we've been talking. My girlfriend and schoolwork is a priority for me.
So it sounds like you're pretty sure you can make this change, especially when you consider what matters most to you in your life right now.
Yeah, I think that's right. Yeah.
Okay, so I'd like to summarize our conversation to make sure I'm not missing anything. I really appreciate you being so open to discussing this with me.
Okay, no problem.
Okay, so today we've assessed your current alcohol use pattern and discussed cutting back on your drinking. Currently, you're drinking well above the lower risk drink limits and have expressed that it's important to you to cut back on the number of drinks you consume. This is something you're very ready to attempt, and you believe that once you have your friends' support, you'll be even more ready to commit to this. Do I have that right? Or anything else?
Yeah. I think that pretty much covers it.
Okay, great. In what ways can I support you in achieving this goal?
Well, let's see. Maybe we should have a check-in about it the next time we should meet in a bit, and you ask me how things are going. That might be helpful.
Okay, then that's what we'll do. I'll be sure to check in with you about progress toward this goal when you come back for your follow-up appointment. Now let's discuss some of your other concerns, and thanks so much for having this conversation with me. So thank you, Ken. So we don't have a lot of time left, but I thought we could just briefly touch on some things that happened during this brief conversation. You may have noticed several of the key motivational interviewing techniques being used by the practitioner. Affirming the patient or the young adult, asking permission to provide feedback or advice, a lot of open-ended questions, and then providing a bit of feedback, not a huge amount, but really key information that might help him consider change. A couple of summaries throughout the conversation. I used readiness rulers to assess readiness, importance, and confidence. Several more affirmations, and eliciting even more change talk once I heard it, and affirming it and asking him to even elaborate a couple of times. A lot of reflections throughout the conversation, and then, of course, a final summary and making sure to identify ways to support him going forward. So what was your take on the conversation, Ken?
Yeah, I think it's a great example of how you can try to move a teenager who maybe isn't thinking much about change to committing to something. And, of course, you weren't forcing abstinence on him or her. That would probably be over the top so early on. But committing the client to think about reducing use is pretty important. Now, one thing, because it's a role play, you might have noticed that you talked a lot as a practitioner, and the adolescent didn't talk as much. And we tried to put a lot of content in a short amount of time. But remember, the principle of you want to try to listen a lot and do a lot of reflective listening is an important one. And some teenagers aren't very verbal, though, so that can be tough to do. The other thing that could happen in a next visit is talking to the teenager about how did the strategies go when he tried to use less with his friends, and maybe even talk to his friends about why he's doing that. And maybe there's some troubleshooting that could be done, maybe some practicing of some skills on how to assert oneself with friends when maybe the peer pressure is working against him. So thank you. I think that's an excellent example of how many of the skills we've been talking about can be used when discussing change with a teenager. Let's finish up with some additional learning materials to highlight. Here are 4 learning videos to help build skills on the use of motivational interviewing with adolescents. Websites are provided. All of them are brief YouTube videos. Then there is a vast suite of resources from Boston University School of Public Health. These videos highlight the following features of motivational interviewing: building rapport, use of pros and cons, feedback, readiness ruler, action plan, and concluding with a thanks. So Carolyn and I wish to extend a thank you for your attendance today. We hope you found this webinar to be useful. And now back to our host, Tracy.
Well, thank you. Thank you both so much. Really appreciate you sharing your expertise with us and really giving us some concrete examples to understand how we might talk to young people. And I think having that scripted language and the role plays really helps bring some of the skills alive that we aren't able to hear when we're just learning it on our own. And so having those examples, I think, is really, really helpful. And there's so much rich information in here that I'm sure that folks will greatly benefit from it. So thank you very much for your expertise and for being with us today. in our last few minutes together, I just wanted to remind everyone that you can locate all of the materials and resources that are associated with this webinar, such as the PowerPoint slides, on our website at sbirt.webs.com. And as you can see on your screen, there's a dedicated web page containing all of the information. And in addition to finding those materials, you are also going to receive an email, a follow-up email from us after the webinar. And this will contain instructions for watching the on-demand recording, which is also going to be located on that website, and information about how to obtain a free certificate of attendance and request to complete the short evaluation survey. If you have questions about this webinar, any webinar series, about resources related to screening and brief intervention, you're thinking about implementation of SBIRT in your setting, you're also thinking about how to evaluate the implementation or evaluate the development of knowledge and skills and the self-efficacy, you are welcome to contact me. I'm glad to provide a free technical assistance session to you by phone, and you can do that by contacting me at the email address on your screen, which is mcpherson-tracy@norc.org. And last but not least, I just want to say thank you all for attending, and thank you to our speakers and to our partners. And I encourage everyone to visit us at sbirt.webs.com, reach out to us at sbirtteam@norc.org. Thank you so much, and with that, we'll conclude today's webinar. Have a wonderful day.